called a code red rally at the Capitol. My next guest is spoke at those demonstrations. His name is Tim Phillips, and he's president of Americans for Prosperity. Tim, welcome to the program. You were there today. What was the purpose for you and these others heading to Capitol Hill this morning?
We just want to keep sending the message to Nancy Pelosi and President Obama to keep their hands off the health care of the American people. The folks clearly don't want this across the country. These guys are persisting in really an ideological agenda, and we're telling them to stop.
Do you think you can actually make a difference between now and the time whenever this health care vote is taken?
I think that the Tea Party movement and activists and rallies like today are the reason this bill isn't already passed. I think it would have passed last fall without the grassroots uprising from the American people, just like this rally today. And there are rallies across the country starting tomorrow from Ohio to Indiana to Arizona in these targeted House districts. And I think that's the reason, this grassroots uprising, that this legislation is not the law of the land today. So it's absolutely making a difference.
Tim, if you feel like you have been heard and your desires not to have this overhaul have been heard, then how do you explain the fact that we appear to be headed towards a vote in the House, which Nancy Pelosi is predicting will result in signed legislation? I mean, Robert Gibbs said by next Sunday we're going to have a signed health care bill, that it's going to be the law of the land.
We've heard this song and dance before. The speaker told us last summer, remember? Oh, don't worry, by Labor Day, this bill will be law. Then the president said, hey, by Thanksgiving, I want it on my desk. And Senator Majority Leader Reid said, don't worry, by Christmas, it'll be done. And it was a blue Christmas at the White House. And so we've heard that tune before, the argument of inevitability. And that's all they've got right now. They don't have the American people on their side, and the facts are certainly not on their side. So they're trying to push this. It's going to happen no matter what. We've heard that for over a year.
Tim, how do you respond to those who say, all right, so the polls may suggest that the majority of Americans don't want this particular health care bill as it's now styled. But when you break it down for them, do you want coverage of pre-existing conditions? Do you want to be able to take your health care with you when you lose your job? Do you want your 20-something-year-old child to be able to stay on your policy? Americans answer in the majority, yes, we do. And so the responders to your argument say Americans do want health care reform, and people like you don't understand where they're coming at this from.
Americans look at a 2,000-page bill put together behind closed doors, creates an estimated 118 brand new federal agencies or boards, $1 trillion alone in the first decade, adds to the debt. They look at that massive new government entitlement and bureaucracy coming down the road, and they realize that's bad for their families, bad for their jobs and their small businesses. And the fact is, Congress could have passed individual snapshot reforms that would make a difference for average Americans. They chose not to. Instead, they want this massive new government bureaucracy. And Americans look at that and they're saying no way. And that's what you're seeing from the polls. The fact is, if they really wanted genuine reforms to move this ball forward, they would take some of those individual ideas instead of trying to cram this 2,000-page bill down the throat of the American people.
They of course say that they can't. They can't do it piecemeal because it won't work piecemeal. In other words, you can't offer coverage for pre-existing conditions unless you have more people paying into the system, because that's going to cost the insurers a lot of dough. That's how they respond to your argument. I want to point out on the screen next to you now it's empty, but milling about this hallway throughout our discussion have been some top Democrats and their aides. They've just emerged from a closed-door meeting, and we expect to have them come to the microphones momentarily and tell us what, if anything, they've accomplished. So standing by for that, just so our viewers know. Tim, let me ask you, if in fact the Democrats do have the votes for this, and we do see, as Robert Gibbs predicted, this thing become law with President Obama's signature by the end of this week, then what? Where do folks like you and the Tea Party activists we've been watching go?
We will work very hard to make sure that when it goes, the so-called fixes go back to the Senate, that we push to defeat them in the U.S. Senate. But candidly, this House vote, I believe, and we believe, is the crucial vote. And so reconciliation is, in my view, overplayed a bit. The fact is, if the president has a bill on his desk that's been passed by the Senate and now the House, we think he'll probably sign it no matter what the American people think. And that's wrong, and it's outrageous. So we think this House vote is really the crucial step. We'll keep fighting if it passes. I don't think it's going to pass, though. I think if the Speaker had the votes, this vote would have already taken place. You may have heard Congressman Clyburn and the Democrat leadership say this morning, I believe it was, well, you know what, maybe we'll push the vote back to Easter now. We're past Easter. If they had the votes at this moment, they would hold the vote quickly. They would have already done it by now. And the fact is, they don't have the votes yet. There's too much pressure on these members of Congress from the American people.
Well, we will we'll hear what they have to say momentarily. Can I just ask you before I let you go, did in fact the members of your group go into the offices on Capitol Hill and knock on doors and speak to congressmen and women?
Yeah, a number of them did. And there were folks there from really across the country. I met people from Bucks County in Pennsylvania and Maryland, the Eastern Shore of Maryland, and even over in West Virginia, Indiana today. And they did. A number of them did go inside, take the time to go to their members' offices, just like thousands of people are doing back home in the district offices as well. And that makes a difference.
Okay.
Going into those district offices, and I hope folks are doing that.
Okay, Tim Phillips, thank you so much for being here.